Assalamualaikum everyone, I hope all of you are doing well. In the previous video I have already talked on BMI, body mass index. In this video I am going to talk about obesity. So the obesity is defined as when the BMI of a person is 30 or greater than 30 kilogram per meter square, we will call the person is obese. BMI of obese person is 30 or greater than 30 kilogram per meter square. So as I have already discussed in the previous video that obesity have three classes. The class 1 is the obesity in which the BMI of a person is in between 30 and 34.9. So the person will have said to be class 1 obesity. And when the BMI of a person is 35 and 35 to 39.9, the person will said to have class 2 obesity. And when the BMI is above 40, the person will have class 3 obesity. Now, what are the causes of the obesity? We have mainly three causes of obesity, but among the three the most important one is the energy imbalance. The energy imbalance means that we actually take a lot of food but we expend less food. We have actually a sedentary lifestyle, we don't consume the food but it takes the food a lot. So the food then converted into fats and it then cause the obesity. So this is the one main cause. The other is drug induced. For example, some drugs like glucocorticoids, antipsychotics and oral hypoglycemic can cause the obesity. And the third cause is the neuroendocrine disorder. For example, the Cushing syndrome and the polycystic ovarian syndrome can also cause the obesity. Cushing syndrome actually causes the abdominal or central obesity. So now how to diagnose the obesity? The obesity is diagnosed by BMI, by calculating the BMI of a person, body mass index. For example, if the body mass index of a person is above 25 or it is above 30, then you should do the waist circumference in order to assess the abdominal obesity. If you do the waist circumference and the waist circumference comes out to be 40, greater than 40 per man, and 35 greater than 35 per woman, then these people have increased risk for hypertension, for diabetes, for cardiovascular disorder. Now how to treat the obesity? The obesity is mainly treated by three methods. Number one, it is treated by diet and exercise. Take the less food and do the exercise. That is the initial and most important treatment for the obesity. The other is if the diet and exercises fail and it don't reduce the obesity, they go for pharmacologic treatment. In pharmacologic treatment, we actually gives the drug to the person which actually reduce the obesity. For example, drugs are orlistat, locazarine, penteramine plus topiramate are given. So these actually cause reduction of weight. The third method for reduction of obesity is the surgical, and this is the most important and most penetrative treatment for obesity. But the surgical method should be applied for those people whose BMI is greater than 40 and who have done a lot of exercises and who have restricted the diet and who have tried the pharmacologic treatment a lot but they didn't get any benefit from these two methods. Then you should go for surgical method, and the surgical method is the bariatric surgery. So this was all about obesity. For more videos, subscribe, like and share. So thanks for watching the video.